Welcome to another episode of Three Plastic Surgeons and a Fourth. I have with us, as always, Dr. Lawrence Tong from Toronto, Canada. He is at Yorkville Plastic Surgery. Dr. Sam Jejurikar from Dallas, Texas. His Instagram handle is at Sam Jejurikar. And the third plastic surgeon who will not be joining us, but will be joining us again soon, is Dr. Salvatore Picella from La Jolla, California. And his Instagram handle is at San Diego Plastic Surgeon. And I'm Sam Rhee. I'm in Paramus, New Jersey, and my Instagram handle is at Bergen Cosmetic. We have a topic today which came out of the fact that we realize patients have so many common misconceptions about a lot of plastic surgery procedures where they think they know what these procedures are all about, but there's actually a lot out there that is actually myth, rumor, or just completely not true. And so today we're going to go ahead and cover liposuction, which is probably one of the most popular and most common procedures. But before we start on the misconceptions of liposuction, we'll have Dr. Sam Jejurikar talk about our disclaimer.
Yes, this show is not a substitute for professional medical advice, diagnosis, or treatment. This show is for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment after appropriate discussion. Always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care, and never disregard professional medical advice or delay seeking advice because of something in this show.
Excellent. So I would say I get asked at cocktail parties or casual dinners about liposuction more than any other procedure. And I hear more misconceptions about liposuction than maybe any other procedure as well. I was just at a holiday party last night and someone was asking me about liposuction, and I probably should have said, hey, just listen to this podcast episode and I'll answer all your questions. So let me ask both of you, what is the most common misconception you hear about liposuction from patients or just randomly out there that you would like to dispel?
I think there's so many. Well, maybe we'll just take turns. I'd say the one that's coming to mind right away for me right now is that after pregnancy, that liposuction can yield a result that's equivalent to a larger body contouring operation. At least once a week, I'll see a patient who comes in for a lipo consult who's had multiple children, who has changes to the abdominal wall and the fact that they have muscle that's stretched out and loose and separated. They've got stretch marks and they just want a little bit of lipo. When I explain to them that the results will not be good, they're like, yeah, I just don't want the scar associated with the tummy tuck. And they'll still sort of press for liposuction. And even after the consult is done and they're meeting with my surgical coordinator and they get their tummy tuck consult, pricing and all that, they'll call back later or they'll ask for a liposuction quote. And I've had to instruct my staff that they're not allowed to give them those quotes because it's not a difference between one result being slightly better than the other. In the wrong candidate, liposuction yields results that are bad.
Agreed. The biggest one for me is, a patient will come in and we'll talk about liposuction and they'll say, well, do you think I'm going to lose 15 pounds from this? So a big misconception is that liposuction is for weight loss, and it is definitely 100% not a weight loss procedure. It's important for patients to know that this is for sculpting certain areas where you might have excess curves or excess bulges to reduce the amount of fat that sits under the skin, and that the amount of fat that we remove is not so significant that you're going to be losing a lot of weight associated with this. And so that's a very common misconception that I get, and patients need to be educated about that.
Both of those are ones I hear a lot. Let me pose this one. And this one was the one I heard last night. They said, I heard that once I do liposuction, I can get fat again and that area won't get fat. Isn't that true?
That is a great question. So the first, just sort of general quick answer is obviously you can get fat again after liposuction. Liposuction is not a panacea against poor lifestyle choices. Can you gain weight in the exact same place? Yes, you definitely can gain weight. Fat cells, although you remove fat cells from a given area, fat cells, you don't get rid of 100% of the fat cells. And under extreme situations, fat cells can hypertrophy or grow well beyond their normal size with more triglycerides. Now, it's not true for all patients that a small weight gain would potentially lead to weight gain in the same place, but for some patients it is. So there's no consistent answer to this. And then finally, what I would say is in the abdomen in particular, if you get liposuction of your abdomen, you definitely can continue to get a fat abdomen after liposuction, except you can't get repeat liposuction the next go around because it's deep fat within the abdominal cavity, which is known as visceral fat. And that is only responsive to weight loss or lifestyle modification.
How about the misconception about I like the one that you mentioned, Sam, about the skin versus just liposuction, but and I also like the one you said, Larry, about weight loss. How about the one saying, you know what, I have you know, all this fat everywhere. Why can't you just lipo more? Like, is there some sort of limit to lipo? I heard there was no limit. You could just take out all the fat that I need in all of these areas. You just have to just keep going.
So that's that's not true. You can't just keep going. There is a limit. The American Society of Plastic Surgeons has a guideline for 5 liters in one session. And 5 liters means the stuff that gets removed, that's called the aspirate. So when we do liposuction, when we remove when we're doing the liposuction, it's not just fat that's coming out. It's a combination of fat, blood, the tumescent fluid, which is a fluid that we inject under the skin in and around the fat as a method of doing the liposuction. There's a recommendation of 5 liters because above that, the patient should be hospitalized or spend a night, you know, in a hospital to be observed. And so there is a limit. Beyond that, you can't liposuction every part of the body. Not every part of the body is amenable to liposuction. So when when we see patients, sometimes they'll inquire about areas that that aren't really amenable. They'll a recent one that I got was, right here at the top of the spine. They had this thicker area of tissue there, and when I looked at it, it was actually the patient's spine. I said, "No, you can't liposuction that. You have bad posture, sitting in front of the computer all the time, and it's not fat." Or some people will want, I don't know, like their forearms liposuction. That's not an area that's done. So the answer is no. It's not unlimited. You can lipo as much as you want. You can, break up your areas of need into multiple procedures if necessary. I always stop at 5 liters. I don't like to admit patients for cosmetic for liposuction because they're, I think that taking out more than 5 liters is probably too much. And then there are areas that you just don't do liposuction at.
Yeah, just to expound on what Larry said, people think because there's small incisions utilized for liposuction that it is minimally invasive surgery or that it's not real surgery.
That's a good point.
But when you start getting over 5 liters of liposuction aspirate, there's profound blood loss that can occur with it. There's electrolyte abnormalities that can occur with it. It can be very dangerous. So, I guess that leads into another myth. Liposuction is a very real operation with real potential risks that go along with it. And it's important that patients are aware of that. You can't just keep going because it can be dangerous to do so.
How about the misconception about massages and compression garments? You need 50 massage sessions, or you need to wear the tightest compression garments possible. Otherwise, these areas are going to blow up and your results will be terrible.
I think we have different opinions on this. I think we had a previous episode where we talked about this, and I think we do slightly different practices. I do think that there are different kinds of patients getting liposuction. Okay, so let's say we have a 20-year-old female that's never had kids, has perfect skin elasticity, coming in for just a small area. Yeah, compression is not that important. Lymphatic massage is not that important. Ultimately, with great skin elasticity, you'll get great results with liposuction. You just need to wear compression for a few weeks. It'll tighten up pretty nicely. Where compression garments might be helpful in that patient, and lymphatic massage would be helpful in that patient, is during that period of time where you're dealing with swelling, they'll look better during that period of time. Then you have different patients, and I do firmly believe this. The patients that you see who have somewhat compromised skin elasticity, maybe not quite so bad that they're getting a tummy tuck and they have all these stretch marks, but their skin, they might be in their late 30s or 40s, and I'm using technology like VASER and BodyTite to try to get the skin to tighten. In those patients, I do think that in the first 6 weeks, that lymphatic massage a couple times a week yields better results because their skin doesn't stretch as much. And I like, for the first 6 weeks, snug compression so the skin doesn't get to expand. I make my patients, or I encourage my patients, even beyond those 6 weeks, to wear compression for another 6 months, which I know you guys don't do. But again, it's just mainly so that they look their best when they're not wearing compression during that phase. But I'm not ready to call that a misconception or a myth. I think there's different ways that people practice where that's concerned.
I'm starting to lean towards the longer compression periods and more massage treatments myself. After that episode, I started playing around with that with my patients, and I feel like you're right. There's something to it for sure, especially like you said, some of the patients who have some compromised skin elasticity. There's definitely something to be said for that. So you're converting me slowly there, Sam. I'm starting to believe in that. What else?
Well, I think LT wants to chime in on this.
I was going to say, since that podcast, I have not changed anything. But I do believe that massage, lymphatic massage, is helpful for a speedier recovery. I definitely think that's true. It's just whether or not you believe that that actually affects the result in the long term, and I'm not quite convinced about that. And plus, sometimes when my patients go get it, they complain that it hurts. So it's just an added, something that they have to do, and I'm not convinced that it adds to the long term. Maybe it's because all my patients are 20 and 30-year-olds with a BMI of 25. Just kidding.
Okay.
All right. Larry has a very good practice demographic there. Wow. All right. What other misconceptions do you hear that you know of that, how about, I've started to see a lot of people who wanted calf liposuction. They believe that calf liposuction is safe and can be done.
I do it.
You do?
Mhm.
So what do you tell patients about the recovery with that?
That they're going to have prolonged swelling with the area just because of its location. But I used to be a skeptic, and then I started doing some cases, and they actually get pretty nice results. It's those patients who have, it's not just the calf, it's that junction from the calf to the ankle where it just sort of looks one diameter instead of that
You mean a cankle?
Yes.
Okay.
Yes, that is the medical term for it. Yes.
Exactly.
So,
I mean, everybody knows what a cankle is.
that, in the right patient, somebody who you verified that it's fat and not, edema, they're usually get a very nice result. And it's not so much liposuction of the calf, but at that lower part of the calf and ankle area, where if you just liposuction that and shape it, I think the results are actually quite good. When I went through training, the prevailing thought was that, calves aren't good to do. But, there was a couple of cases that I did, and I told the patient, might not do much, but I was pleasantly surprised at how well it turned out. So when patients come and ask me, it's not something that I will, automatically be dismissive of. It is an operation that works.
I completely agree with Larry. I think calf liposuction is very beneficial. But I do modify some things postoperatively because I think patients can stay swollen for a year after you do liposuction of the calves. So I had them wear compression garments that go below the knee 24/7 for 3 months. I warn them that they're going to have swollen ankles and swollen feet for 6 months, 9 months postoperatively. And you have to just make sure they really understand that, because I think something's going wrong postoperatively. But I think if a patient's willing to accept that, I think it can be a really nice result.
Mm.
Use
Sam,
small
do you do it?
cannulas. Do I?
No, Dr.
Sam
Rhee.
Rhee.
Oh, I don't. I've never done calf liposuction, and it's not something that I thought was a significant part of my practice, maybe. And I was also of the old school where I just sort of follow the principles we trained. I'd also seen one or two cases of complications of compartment syndrome after calf liposuction, and that really freaked me out. So I've never tried it. I but hearing you guys talk about it, that's really interesting. I'm glad that it's safe, and I'm glad that people get good results with it. That's awesome. I'm probably not going to start doing calf liposuction now, but I might end up referring to you guys when I get those patients.
What about ankle liposuction? Will you do that? Not, I know you won't, Sam. Larry, will you do that?
Yeah, I mean, there's fat around. I mean, usually when a patient is asking for calf liposuction, it ends up being a combination of calf and ankle liposuction. So yes.
I find my results to be not as good around the ankles as more proximally in the calves. I think the swelling there lasts for such a long time. And I, during my fellowship, saw a very bad complication in that area from one of the guys I trained with. So I'm a little more nervous around the ankles.
I
Well,
love knee
fortunately,
liposuction. I'll do a lot of around the knee lipo, but nothing sort of much below.
What are your guys' philosophies on using additional technology, like heat technology, and doing fat grafting? Do you feel comfortable using technologies like VASER, radio frequency, Renuvion, even power assisted? Like, what technologies will you use, and then fat graft?
now you're talking about fat grafting at the same time with liposuction
Yes.
for if somebody's had liposuction before and they have some contour deformities.
Or whatever reason you might want to use those technologies. Yeah. Or do you not standardly use those technologies when you do liposuction?
So I use power-assisted liposuction as my standard for all liposuctions. So for viewers, that is a type of liposuction where the instrument that we use, which is called a cannula, is mechanized, so it oscillates very quickly back and forth, and that helps to, break down the fat. And the benefit of that is that it's more efficient at removing fat per time, and then the surgeon has less effort because we're not putting so much force in trying to advance the cannula, which allows us to, have a surgery which is more akin to sculpting than just sort of brute force. So I think most people do power assisted liposuction these days, and I think it's a great tool. It saves your arm definitely. But as for adjunctive procedures, I think it's important to realize that they do something, and it's usually to try to tighten the skin, but the effect is, I would say, more on the subtle or mild side. So generally something like Renuvion I might use from time to time. Again, I'm not 100% convinced that it makes a huge difference, but in some cases, I think it does. I know that Dr. Jejurikar, you're an advocate, I think, for these technologies. Why don't you let us know sort of your experience with them?
I mean, I think I use VASER basically as an alternative to power assisted. I think the combination of VASER and BodyTite, or VASER and Renuvion, I won't say leads to dramatic skin tightening probably more moderate skin tightening. It's never going to be the effect of cutting it out. But, you know, my question was largely sort of in relation to fat grafting, because there's this whole school of thought that if you use heat technology or something, that you're going to damage fat cells, and that the
Oh,
fat
you're
that you
talking for
potentially
harvest.
for harvesting purposes.
Oh, I
Yeah,
see.
like, do you feel comfortable doing that? And I used to not. And we all trained in a place in a time where if you do anything to the fat cells that could potentially traumatize it, those fat cells wouldn't be okay to do fat grafting with. But there's been a lot of research that actually shows it's fine to use things like VASER and BodyTite and fat grafting. And I've done it in many, many, many cases and haven't noticed any change in my fat grafting retention rate. So that's where I was going. I feel like that was not a good question on my part, though, because neither of you have any idea what I was asking. So
Yeah, no,
sorry about that.
I will use I will definitely use power assisted to harvest fat grafting if I'm fat grafting the body, and I haven't noticed any negative effects in terms of survival with using that.
What is the maximum, if a patient asks, what's the maximum you can inject for fat grafting into somebody? Like 10 liters, 8 liters, 2 liters, 1 liter? Like, what is it that you feel like, and does all of it survive? They're always asking, like, if you inject, X amount, will all of it survive or not?
So first of all, we already ascertained that the maximum amount of fat we could harvest through liposuction is 5 liters. So that's going to be our first cutoff. And like Larry mentioned, when you do 5 liters of liposuction, there is plasma, there's oil, and then there's fat. And for patients that are really thin, there's going to be a lower concentration of fat within that. So let's assume we have a finite amount of fat to work with. Then beyond that, there is, when you inject fat, what's really important for determining fat cell survivability is the pressure within the tissue. So, whether it's the butt, whether it's the breast, we're looking for more superficial planes of injection within the fatty layers. And there's a point where when you exceed the pressure by which capillaries can grow in to support those fat cells, once you start to exceed that amount, even if you inject more fat, the percentage of fat cells that survive the transfer is going to actually go down dramatically. So there is a maximum amount depending on just tissue quality. What percentage? So let's say the surgeon does everything right. They're paying attention to, to tissue turgor or the overall tightness. If everything is done perfectly, I'll typically tell patients that I expect 50 to 60% of the fat to survive the transfer. But then the way I define that is, how much of those fat cells do we think are around at 6 or 8 weeks post-op? That is then dynamic. I mean, fat cells, when you are in times of extreme starvation, yields triglycerides, and the fat shrinks and people think they're losing their fat. Conversely, people put on weight, fat cells will swell. So, the results of fat grafting are dynamic and are changing. So that is my very long-winded way to not really give an answer to that question.
I was like, all right, let me try to pull that answer out of that somehow.
I mean, that's an impossible question to
50 to
answer.
60% is basically what I tell them. And it depends on the area of the body as well, right? Like if you're fat grafting the face, there are areas that are definitely better and areas that aren't so good. Like, for example, the lips. If you fat graft the lips, they usually don't survive as well.
Yeah, no, I was just wondering because there are a lot of patients that are like, doctor, just inject as much fat into my butt as you can. And when you tell them afterwards how much it is, they're like, but why didn't you inject more? Like, you should have injected all of it. And you're like, that doesn't make sense. Like, that's actually, like, as Sam says, counterproductive to what would actually be helpful for results. So I think that's one of the misconceptions is that you can just keep injecting all the fat that you take out. And you take out, like you said, 5 liters, you should be able to inject 5 liters. And that's not the case.
Yeah, at some point you can't. If you're doing a Brazilian butt lift and you keep injecting, the fat starts coming back out the same hole at some point.
That's right. The pressure is just very, very, very high.
Yeah.
As Sam
And so
said.
if you've gotten to there, that's, you're done.
Yeah.
All right. Are there any other misconceptions you want to hit on before we close up on this topic?
I thought of one more thing,
All right.
actually, just
Yeah,
in your
go ahead.
opinion. Do you think patients can get the same degree of results from awake liposuction as they can from liposuction under anesthesia?
Oh, go ahead, Larry.
Definitely not, because if you did the same liposuction that you typically do in a person who's under general anesthesia when they're just awake, they would be in a lot of discomfort. And so I feel that you can't be as aggressive as you would if the patient is still awake. Now, are there methods to get the pain under control such that you can get it to the equivalent? I guess it's possible, but I think that's a very select group of patients that you can achieve that in. So I definitely do not think, I mean, it depends on what you're doing, but in general, no. I think you can be much more free to remove fat in the areas that you want if a patient is under general anesthesia. And I think you're just limited. You're limiting yourself if you try to do it in an awake state. So when patients ask me about that, that's what I tell them. I said, it can be done, but why would you undergo a procedure where you might be limited in achieving the result that you want to achieve? Just go under general anesthesia.
That's interesting. I'll be devil's advocate and say, because I do a fair amount under light sedation. They're not like awake, like without anything, like pure local, but they'll usually have a little bit of something on board, but nothing that would even qualify for real sedation. And I would say and I feel like I can get results that are comparable. The biggest drawback to it is that I have to go slow. I can't go fast. My rate of liposuction is slower. My rate of infusion is slower. Everything is slower, because you're right. If you try to go really aggressive and really fast, patients are not going to like it. So it's,
So
I think
when you say light sedation, like what are you using?
maybe a little bit of Xanax or something, maybe half a Percocet on board or something like that on top of the local. So just a little bit of oral sedation, something very light. And I feel like in most patients, I can achieve a comfortable state as long as I infusing slowly, liposuctioning slowly. That is pretty comparable to what I would do under full general anesthesia. It's to me, it's something that I've done a lot of. Let me put it that way. I've done, I would say, 90% of my lipo in that sort of setup, and so maybe I'm wrong. Maybe if I had done it all under general, I would probably say, oh no, I could be way more aggressive. But it's what I know, and so it's just sort of been my experience with.
Yeah, I mean, I've definitely done a fair amount of awake lipo in the past, and there's still some areas that I'll do, like underneath the neck. I think is really
Yeah,
easy to
the neck is
do
fine,
on
yeah.
patients. Yeah, while they're awake. Limited areas, if it's a fit patient with a relatively small volume of liposuction, I feel pretty comfortable doing it in the manner Sam described. Except it does take so long that I don't love it for that reason. But like large volume liposuction, 4 or 5 liters in a patient,
Oh yeah, I agree with that.
I don't feel like I can get great results on that.
Yes. Okay, you're right. Large volume lipo, yes, absolutely. But I don't do a ton of large volume lipo in a lot of my cases. But you're right. That would probably necessitate a deeper level of anesthesia.
Yeah,
Okay.
I agree
Awesome.
with both of you. Smaller areas, definitely you can do it. Larger areas, no.
Right. Wow. Well, this was informative. I think it was super helpful for a lot of people, hopefully. And if anyone out there has any other misconceptions about anything else, send them to us. We're happy to answer them. And until next time, thank you very much, guys. Take care.